things health and wellness. Today, we're exploring a condition that affects millions worldwide: allergies. We'll talk about the types, common triggers, and the best treatments to help you live comfortably. Don't forget to hit that like button and subscribe for more helpful content. Let's get started. What are allergies? So, what are allergies? An allergy is your immune system's overreaction to a substance that's normally harmless, known as an allergen. When your body detects this allergen, it releases chemicals like histamines, leading to symptoms that can range from mild to severe. Quick fact: did you know that over 50 million people in the US experience some form of allergy each year? Types of allergies: there are several types of allergies, each with its own triggers and symptoms. Let's break them down. Seasonal allergies: hay fever, triggered by pollen from trees, grass, or weeds. Food allergies: common culprits include nuts, dairy, shellfish, and eggs. Skin allergies: conditions like eczema or reactions to plants like poison ivy. Dust and mold allergies: caused by dust mites, mold spores, or pet dander. Insect allergies: reactions to bee stings, wasps, or ant bites. Drug allergies: reactions to medications like penicillin or aspirin. Common triggers: let's talk about what can set off an allergic reaction. Common triggers include environmental factors: pollen, dust, mold, and pet dander. Foods: nuts, seafood, dairy, and wheat. Medications: antibiotics, pain relievers, and even some vaccines. Insects: bee stings, ant bites, or mosquito saliva. Your triggers depend on your specific allergies, which is why identifying them is crucial. Symptoms of allergies: allergic reactions can vary widely, but here are some common symptoms. Sneezing and runny nose, itchy, watery eyes, skin rashes or hives, swelling in certain areas, difficulty breathing or wheezing, anaphylaxis. A severe reaction that requires immediate medical attention. If you notice these symptoms, especially after exposure to a potential allergen, you may have an allergy. Treatments and management. Now, let's discuss treatments and how to manage allergies effectively. Avoidance: the best way to prevent reactions is to avoid your known triggers. Medications: antihistamines relieve sneezing, itching, and runny nose. Decongestants reduce nasal swelling. Corticosteroids help with severe inflammation. Allergy shots, immunotherapy, gradually reduce sensitivity to allergens over time. Epinephrine for severe reactions like anaphylaxis, always carry an epinephrine auto-injector. Host: consult an allergist to identify your triggers and create a personalized treatment plan. Prevention tips: prevention is key when it comes to allergies. Here are some tips. Keep your environment clean. Use air purifiers and wash bedding frequently. Monitor pollen counts. Stay indoors during high pollen days. Read labels carefully, especially for food and medication allergies. Wear protective gear. Masks and gloves can help reduce exposure. Allergies can be a challenge, but with the right knowledge and tools, you can manage them effectively. Share this video with anyone who might benefit from it, and don't forget to like, subscribe, and hit the notification bell for more health tips. Thanks for watching HGH Health Hub. Recover and thrive. Stay healthy and thrive.